The measles outbreak spreading across the country now with more than 300 cases and at least one death in Texas from a child who was not vaccinated and had no underlying conditions. While the Centers for Disease Control says the risk remains low, there are dangerous, long-lasting health consequences for this highly contagious disease. Joining us now to discuss is Dr. Elizabeth Mumper, Senior Fellow of Pediatric Education with the Independent Medical Alliance. Good morning to you, Doctor. Great to see you this morning.
Good morning. Thank you for having me on.
First, help us better understand the true risks of measles for both kids and adults.
Well, kids actually tolerate measles pretty well if they are in a developed country where they have access to clean water and good sanitation. The story is different if a child is living in a developing country where they do not have good sanitation measures. The risk of death is probably somewhere in the 1 to 10,000 if you count only the reported cases, and 1 to 500,000 if you actually look historically at all the children that had measles that did not seek medical help. So parents should really not be afraid that their child is going to die from measles. Now, unfortunately, the child in Texas who died had a complication of bacterial pneumonia. And some colleagues who have looked at those medical records suggest that perhaps she did not receive adequate treatment. One of the doctors on the ground there was concerned that her treatment was delayed and that she didn't get all the things that she could have. But one of the unexpected or unintended consequences of MMR vaccine is to shift the age of measles from children who historically have tolerated it very well to older populations, including the elderly, where there are more likely to be complications.
Right.
Some of these include things like thrombocytopenic purpura, which is a low platelet count that leads to bleeding, or potentially measles encephalitis, which is an infection around the brain or spinal cord. And those are more likely to be a concern in older age groups. And unfortunately, we do see outbreaks of measles even in colleges where the MMR vaccine uptake rate is greater than 98%.
Why is that? Why would we see that?
Well, for several reasons. One is that it's very difficult to have a medical procedure, including vaccines, that are actually 100% effective. And about 5% of people don't respond to their initial MMR vaccine. But in addition, over time, the immunity from the vaccine can wane, whereas if you actually get measles, you would have lifelong immunity. So people born before 1956 have probably already had measles, and we have lifelong immunity and don't need to be concerned about this outbreak.
What are the long-term consequences? You said that parents shouldn't have to worry about death, but there's still some long-term consequences here if you were to be infected with measles.
Well, they're very, very rare. They would include things like getting a bacterial pneumonia, which should not be long-term. But there are a few cases of encephalitis where the brain and spinal cord are infected by the measles virus. And unfortunately, those people might have a long-term consequence of getting paralysis or brain damage or losing hearing or vision. It doesn't happen very often. But one thing that many people don't know is that there are actually some good long-term consequences of getting measles as an infection. It's been tied to lower cases of certain types of cancer, lower cases of cardiovascular disease in adulthood, and lower cases of strokes have all been seen.
So what are the initial symptoms that parents should monitor?
Well, the classic ones are cough, coryza, which is another word for a runny nose, and conjunctivitis, which is pink eye. There are little spots on the inside of the mouth near the molars called Koplik spots. And if those are there on physical exam, you can actually diagnose measles very early and start taking care of the child.
I'm sorry, we've run out of time.
And of course, the rash that you showed a few minutes ago.
Right. And I have so many more questions about this. We're going to have you on again for a deeper dive about measles, the IMA has a full webinar that you can see for yourself. For more information, just go to imahealth.org. And Doctor, such a pleasure to talk to you this morning. And I look forward to listening to your webinar as well. We appreciate you joining us here on the National News Desk.